Hello, this is Dr. Lewerenz at Longevity Health Institute. Part 2 here on some cardiovascular talk. As I promised, I was going to talk to you about egg consumption and the potential good and bad about eggs. This is actually referenced, by the way, so you know it's not just an opinion. This is referenced just from March of 2019 here, the American Journal of Medical Association and the New England Journal of Medicine. New articles on here, just post from a convention from the American College of Cardiology, the American Heart Association. So these are studies and recommendation and guidelines now that are given and just been published out and I just received. And one of the interesting thing I think that I found out from these new studies and this new publication is a common question we get in the office here all the time. Whatever diet you follow, whether it's you or your parents or loved ones or family members, everybody always asks, are eggs good for you? Are they bad for you? The interesting thing in these new studies and in these new guidelines is this, is that eggs consumption in and of themselves are not an independent cardiovascular disease risk when controlled for cholesterol. The thing is, they have a lot of cholesterol, and the studies do show that the higher cholesterol consumption you do have, that cardiovascular events and risk do go up. So this is going to make this a little bit confusing, but I'm going to kind of narrow it down to, like, you know, the nuts and bolts here of what it means. But most Americans, the average American consumes about 325 milligrams of cholesterol a day. The average American consumes about 3 to 4 eggs per week. Okay, and when the cholesterol in those, along with other animal products or cholesterols, are consumed, actually, and more than the median average of cholesterol goes up, okay, with the egg consumption, there is a significant increase in cardiovascular disease. Actually, it's about 17% increase in cardiovascular events, and that is in a study approximately, they study about 6,000 patients. So it's a significant study. It had a good p-value, meaning it's a quality study, okay? The thing, though, is this, is that really when you narrow down the data and you look at the recommendations, really it comes down to this. If you consume more than 2 to 3 eggs per week, okay, your cardiovascular risks go up, okay? So the idea of consuming, you know, 1 or 2 or 3 eggs a day because of the protein content and the benefit from a paleo diet, and you know I believe in paleo diets and such, but is probably an overshot because most Americans consume a decent amount of cholesterol in and of themselves, and then those cardiovascular risks go up because of the volume of cholesterol. But if you're having 2 to 3 eggs per week, the idea in general would be that you would be safe, and there's no statistical data to show that you're getting much of an increase in cardiovascular risk. There may be a tiny bit, around 1% or less, but not to the significance of, not that that was statistically significant. The other thing that I find interesting in this, and this again is published in the Journal of New England Journal of Medicine, and this is just March of 2019, is that there was in another article stating there's some new guidelines for the American College of Cardiology, and some of these new guidelines, albeit again narrowing down the information down to something simplistic here, the new guidelines do have, if somebody falls into a lower risk or kind of an intermediate risk of 7 to 20% of cardiovascular disease in the next 10 years, how we look at cholesterol and other risk factors is a little bit of an expert judgment, meaning, like we do here at Longevity Health Institute, we kind of look at you a little bit more detailed and look at risk factors, meaning do you have hypertension, do you have diabetes, do you smoke, have you had an early previous cardiovascular event, do you have strong family history of cardiovascular disease, are you obese? These are all things that then make your risk go up, and we have to consider your cholesterol and not just ignore it. Now here, you've heard me talk about in previous videos, we do and really strongly believe in cardiac calcium scores as well as carotid Dopplers looking at intimal thickness and plaquing, and also looking at, we have here at our office a central blood pressure and a digital pulse analyzer that looks at basically vascular elasticity and endothelial function, meaning blood flow, and basically early vascular disease. So when we tell somebody and give them just dietary guidelines, and aren't concerned about total cholesterol, that's our 250, 300, there is a purpose to that, because we've screened you, we've ruled out any big risks with you, and we're working on you at your cholesterol from a dietary lifestyle standpoint in a personalized way. But also what's interesting and why I feel confident about taking that approach is this. If you just go back 20 years, the guidelines for cholesterol total were in the 300s. And LDL didn't have as much significance. It's a little bit confusing, the data on this now, but you have to take in lifestyle and personal risks and putting it together and having a relationship with your practitioner, your physician, and hopefully it's somebody that listens to you and spends the time that can put all this together, so that you're not lost in this. Are you sitting with any cardiovascular risk or health concerns and turning a blind eye? So hopefully that helps. The take-home message here is you can have some eggs, especially if you follow a paleo diet. I believe in mostly a whole plant-based, more of a Mediterranean paleo diet. What does that mean? Gluten-free, dairy-free, a decent amount of protein, but mostly plant-based, a lot of vegetables, a lot of fruit, a lot of nuts, a lot of stuff that's made in the earth. Okay, mostly. I don't consume red meat. I don't believe in red meat, but also that's a personal choice. If you do, it should be very limited, because you've heard me talk about the blue zones, and even Mediterranean-wise, people that live the healthiest and the longest aren't consuming much red meat at all in a year's span, maybe a couple occasions in the year. But eggs, you can have limited, again, 2 to 3 per week, sound reasonable. Again, but you have to look in the mirror, what are your health risks? If you have other health risks, you may want to second guess that and take eggs off your menu. So hopefully this is enlightening and educating. This is Dr. Lewerenz, Longevity Health Institute. Always happy to intervene, help you with your specific needs in a personalized way, or bringing you a wellness, comprehensive, personalized approach. Always a functional medical approach, which looks at foundational systems in your body, fix you from within out, and always bringing you the best in personalized medicine. So this is Dr. Lewerenz, Longevity Health Institute. Be well.